around out there have questioned whether or not, why renew when they don't see it working?
Well, then I think they need to ask the question, because ESIC has, through governments and their involvement, ESIC has delivered on a number of initiatives. Clear vision and dental health coverage for those with low income, not just those on assistance, those in low income. That's been provided. Social assistance reform in 2012 was done through the ESIC process. Let's see what else we've done. We've got childcare concerns have always been brought forward by the ESIC group. They've been at the table for all the major reforms that have happened in government. And the reason that some of the changes happened the way they happened was because we had community, we had nonprofit, we had government, and we had business at the table giving us counsel to make sure that when we put something through, it had an effect that moved the needle. And there is an inclusion factor to this. A lot of people are isolated in society by their societal status. And so the Economic and Social Inclusion Corporation has worked very hard to ensure that individuals in a lower income status have always remained part of this process.
We've asked you questions about, and maybe the problem isn't that it got worse, but that we were hearing more about homelessness specifically in Fredericton and Moncton. How will renewing this plan help that issue?
We can't ever stop the talk about poverty. That's a conversation that needs to continue for as long as we have it. And we may not be able to eradicate it completely, but if we can have an understanding of why people live in poverty, what will take them out of poverty, what will move the needle, and in particular for OPT3, we've had a number of initiatives from OPT1 and OPT2. 95% of those initiatives from the first plan have been implemented. The other is ongoing. 75% from OPT2 have been initiated, and the other 25 are ongoing. So my hope for this plan is that we focus on one or two really big things that can continue to move the needle. Not just feel good about it. Let's say that we've moved the needle.
What will your government do if one of the things you find in the community engagement process is that there's a much bigger role for the provincial government? You don't have a lot of money. What if they say there's a bigger role for instance, increasing welfare rates, putting more money into the system?
It's hard to say what government will do today, Jacques, but what I can say is this, is that government has shared a large portion of the responsibility of carrying forward most of the recommendations that have been in the report. And it's because it's garnered weight because the recommendations haven't been arbitrary. They've been worked on by the community, by nonprofit, by business, and by government together. And so we see there's value in what they bring to the table. So you focus on that, and it may not happen overnight, but that's what you strive to do. You strive to implement plans that make sense, and that they're not a plan of government. They are a plan outside of government that should last government in, government out.
Why does it need to be a totally new plan? Can you not build off the plans that you have?
It actually, that's what will happen. It won't be a totally new plan. It will build on what we've begun and where we need to go, where the gaps still remain. That will be the focus of the consultation. But again, it's got to come from all of the province. It can't be just an arbitrary decision of government. We'll move the needle forward when we all have make a conscious effort to buy into what we're going to do.
So if next month the budget comes out and then there's some deep cutbacks in social assistance, will this affect the recommendation? Would they take that into consideration with the cutbacks and that?
We have a consultation process that's just beginning, so it's not going to be completed until later this year. So this next month's budget, although will have an impact on what we're doing, whether it's up or down, isn't going to have any impact on the consultation process that we put forward. And whatever recommendations E6 comes forward with, government will strive to analyze, implement, tweak however it needs to be done to make it happen.
How much is right now budgeted for the corporation?
ESIC has had a budget of $2.6 million, and that's been consistent.
And that's not likely going to change this
No,
budget?
no, and this consultation process will be done within the corporation's budget.
I have a question for one of my colleagues out of St. John. He wants you to comment on comments that were made by the head of Horizon Health recently, suggesting that it would be better if nursing homes fell under the health authority's jurisdiction instead of.
Sure, so we're doing a press conference on ESIC. I'd be happy to do a sidebar with you on that afterwards. Any other questions on ESIC? I want to thank you all very much for coming today. This is another launch of an important issue, and we look forward to partnering with our community partners.